My name is Summer Aldrugh. I'm an interventional cardiologist. I'm also board certified in vascular and endovascular medicine at Prisma Health. I attended undergrads at University of Georgia in Athens, and then I went to medical school in Medical College of Georgia in Augusta, Georgia. After that, we ended up going to Massachusetts, where I did my internal medicine residency, my cardiology fellowship, and interventional cardiology fellowship. And then I spent the last year of my training in Providence, Rhode Island, at Brown, doing my vascular medicine and endovascular interventions fellowship. So the reason why I chose cardiology, because I was fascinated by the pathophysiology and the science behind it, and how it combines different aspects of plumbing and mechanics and electricity of the heart. As an interventional cardiologist, our main job is to help people who have blockages in the blood vessels that supply their heart by using different catheters, wires, and stents in order to open that blockage and restore blood flow to the heart muscle. So interventional cardiology is the specialty, it's a subspecialty of cardiology, where we are trying to help patients who present with either chest pain that's been stuttering for a long period of time, or they're coming with an acute heart attack, restore blood flow to the heart muscle. And we do that initially by obtaining pictures of the heart and the blood flow to the heart muscle. And then once we identify a blockage, then we can use different catheters and specialty wires, balloons, and stents to open that blockage and restore blood flow to the heart muscle. And as a result, patients feel better and end up living longer. Within interventional cardiology, a big focus of mine and big passion is treating patients with peripheral vascular disease. And what does that mean? It means that patients who have disease either in the blood, in the arteries or the veins outside the heart. So whether these arteries are going to the upper arms, the legs, supplying the kidneys, their gut, basically we take care of that. And our main focus is to try to prevent patients from having peripheral arterial disease, and also identifying these patients early in the disease process, and also intervening on them so we can avoid limb loss or amputations, which is the ultimate complications of untreated peripheral vascular disease. Colombia, and especially North Colombia, has the highest amputation rate in the country. It's about 10%, and that's due to multiple factors. Part of it is genetics, the diet, the food deserts, and also not having enough vascular specialists in the area. And so it's one of my biggest passion, not to just educate patients to recognize the signs and symptoms, and also teaching them how to avoid and prevent developing peripheral arterial disease, but also to educate primary care physicians and other providers in order to find and identify these patients early on in the process, so we can help and treat them and prevent the ultimate complication, which is the loss of their limbs. So I have a 3-year-old, and so my main life right now evolves around him and to keep him entertained. So we end up going to the park a lot, we do a lot of hiking, we do a lot of crafts, and a lot of reading books and going to the library. And other than that, cooking sometimes when I have time. If you're concerned about potentially having peripheral arterial disease and would like to have a screening for that, or you think that you have risk factors for peripheral vascular disease, please call the number on the screen and we'll be happy to take care of you and your family.